Hey everyone, this is Josh Guttman here from Peachtree POCUS, and today I'd like to give an overview and a review of the Butterfly IQ3 transducer that I've been using for the last couple of weeks. That came out in February of 2024, but I've gotten to use recently, and I wanted to give you a walkthrough in case you were thinking of buying one or weren't sure if you should be using it, as well as a review of it and the cool features that I like about it. So firstly, I only used the IQ, the original one that was put out a few years ago, and so I skipped the last version, so I can't really compare to the IQ Plus, but I can compare to the original, and the IQ3 is a big improvement. The convenience, the image quality is head and shoulders above that last one, so certainly really a great improvement on what was before. A couple things that have also improved is the last one you had to choose if you were going to use a lightning cable or a USB-C. I liked having both because at work I was using it on my phone, and so I was able to plug it in with my lightning cable because my phone uses a lightning cable. But when I'm using it for teaching with my iPad, which is a USB-C, it's nice to be able to have that USB-C in both. And you originally had to choose, and this one you don't. This is the cable that plugs into the back of the IQ3. Again, here is the Butterfly IQ3 that I've been using. Here it's not attached to anything, but you can then plug in the cable in the back, which has either USB-C or Lightning. And you can plug it in the back like this. So it plugs in relatively easily. Make sure it's secure. And then you attach it. And this one is attached to my iPad. Just pulling it out. And you have the USB-C. But you can also have the lightning cable here, which is also attached in the same way. So you can have them both available as much as you need. The other thing I wanted to point out is the buttons on the front. So you can see there are these 3 buttons, which are customizable. So the way I have them set is the bottom one and the top one are for depth adjustments, and then the middle one can take a still image, and those can be toggled to change in the settings, which I'm going to show you on the machine. The other thing I'd like to show you is the charger. On the original IQ, the charging base was a little bit bulky, but this charger over here, which clicks right easily into the back of the machine magnetically, so it just attaches really easily. And so when I'm using it clinically, I can just put the ultrasound down next to me. It's plugged into the wall, and I can just lay this down, so it's lying just right down. And then when I'm done scanning, and I'm doing my charts or reviewing patients with a resident, I can just stick it right down and it just connects and it rests really nicely. And so it's easy to carry around, it's not bulky, and it's very convenient to use. I'm gonna go ahead and plug it in, and then we'll switch to my iPad screen and we'll get started in showing you all the features. All right, so this is plugging in the ultrasound. Here's what you're gonna see on the screen. If you look at the top left corner, there's this arrow that points downwards, which is where you can get to your various settings. Here's old images. Down here is the education, and here is the scanning. If you press on that bell button, it's for notifications if there are any updates to have. And then in the bottom right corner is where you can get to your settings. So I'm going to press on my setting, and here's where you can toggle some of the settings. Up here, changing the probe button actions. And so those are the buttons on the screen that I showed you earlier. So if I press on that, you can enable those actions, and you can change it from the center button to start and stop or capture a single image. I have it on starting and stopping a Cineloop, and then you could change it for depth gain and to change modes. Here's the up and down button. So you can change it as you see fit. And then if you go back to your preferences here in the corner, that's where I was before. So you can have various settings. And so the other one that you might want to change is the max Cineloop. So if I click on that, it could change to either 60 seconds, which is long. So for example, if you wanted to take an entire video of a procedure, or you can set it, the diagnostic ultrasound, which is typically 6 seconds, you can set it to that or anything you like. So I set it there to 6 seconds. And then some of the other things are there, but those are the main settings that I think are important. So let's get back to the scanning. So I'm going to press on this middle button over here to get back to the main scanning screen. And this is the abdominal preset. So you have the presets here in the bottom corner. So if you click on the preset, that takes you to the presets, and you have all the different presets that you would like, fast, long, soft tissue, all the way through various vascular access options, and you just swipe them easily with your finger, so it's easy to change. Let's take here on the abdomen one. That snowflake right next to here is to freeze the image, and then next to here, this movie camera is the Cineloop, so you can see that it's set to 6, so it's 6 seconds in the middle. See, it auto froze, so I went back because I wasn't actually using the probe. And then the actions buttons I'll go through, which is for some of the features that can be done with the ultrasound. So I'll show you that soon because each preset has its own specific action buttons. The other thing is you can easily change the depth and the gain on the screen when I swipe my finger up and down. So if I swipe my finger up, I'm making the depth larger, and you can see, all right, auto gained again, and the depth lower and higher. Okay, and the gain is if you go right and left. There's a gain up and down, and you can remember because it actually tells you right and left and up and down whenever you click on the screen. Okay, let's get to scanning. I'm going to scan myself here, so I just put some gel on the transducer, and I'm going to put it here on my right upper quadrant. See if I can get a picture there. Here we are. The gain's probably a little high because I just adjusted. I was just playing with the gain, so I'm going to turn that down a little bit. Great. And if you preset, it'll actually set something that's pretty good. Alrighty. Not the best at scanning myself, but here you go. All right, let's go to the action buttons. I want to show you specifically the eFast protocol that's over here. And these protocols are basically how you can go through and label each image, and especially if you forget what you're supposed to do next, it walks you through everything. So if you're doing an eFast, it'll actually take you through all the eFast stuff. So I'm going to go ahead and click on that now. And then it brings up a patient image. Let's say now I'm going to do the right upper quadrant. So I'm going to press on the right upper quadrant button right there. And now it labels, as you notice, the right upper quadrant. So now if I'm saying, okay, I'm going to go save the right upper quadrant. So I'm going to press on the Cineloop right here, and then it's recording, so I'm fanning through as it'll record its 6-second image. And then once it's done recording, it automatically gets back into the protocol. It says the right upper quadrant is done, and then I can move over. So let's say, for example, I'm going to do the left upper quadrant. I can then press here on the left upper quadrant, and then the label changed automatically to left upper quadrant. If you want it to label, it labels it for you so you don't have to change it. Let's look at my left upper quadrant. There we go. Now I'm going to go back to actions. Now if you just wanted to save, you can save just as before. But I want to show you a cool feature. So I'm going to press on the actions again. So actions. And up here you got all the modes that you need. Power Doppler, color Doppler, pulse wave, etc. M mode as you need. I just swipe through, but I want to show you IQ Slice. So the IQ Slice is pretty cool because that basically just fans for you. So my hand is not going to move, but it's going to fan for me, and I'll show you what that looks like. So IQ Slice is there, and you can do it either in still or Cineloops. So I like the Cineloops, so I'm going to do that. So I'm going to capture Cine. So I'm going to press that on that blue button, and it's going to capture the Cineloops, and it's fanning, as you can see, without me fanning at all. So I'm actually not moving my hand. It then captured, and it was done. So just pressing that button helped you go through it if you like to use that IQ Slice. And then if you just want to fan yourself, you can, but you can use the IQ Slice as well. I'm going to go ahead and exit the protocol, but you can go right through it and keep on choosing whichever place you want to go. When it's done with the protocol, it'll just exit, and then you'll have all the images saved. But because this is a demonstration, I'm just going to exit the protocol. It warns you that you are exiting the protocol. We'll do exit. Great. Now I'm going to show you just the IQ Slice if you wanted to capture stills. So I'm going to press on capture stills. It does the same thing. It fans through, but it'll have still images. So you can then choose one if you want it to save. I can select this one, and then it'll save. It'll put it on there, and I just have to press this camera button, and the image is captured. Perfect. All right, then I click done in the corner, and then I can click on this X down here to exit, or I can save them all, which you probably don't need to save them all, but you could if you wanted to. All right, now to get rid of the IQ Slice or any of those features, I just press on the X right next to it. So I'm going to X, and now I get back to the regular B mode imaging. All right, let's move over to the bladder now because I really like one of the Bladder AI features that I wanted to show you. So I'm going to press on presets. I'm going to go down to Bladder right here. And I'm going to show you the Bladder volume preset. If I go on actions, which I'm going to press on in a second, then I can get a auto bladder volume. So now I'm on my bladder. Now, if I press on the action button, action, I can get a volume that's auto calculated. So right in the middle here. So I have all my features, the modes, the power Doppler, etc. But I'm going to click on the auto volume. Then it'll highlight, so you just have to get your entire bladder in image, and this is in long axis, and calculate it. And then it'll go through and give me a volume. I definitely have to go pee, which I'll do at the end of this video, but just to show you that it gives you a good bladder volume, and then you can then click save, and that saves your image and your measurement. Great. So I can press this X in the corner and go away. Now I'm going to go to a different preset. Let's look at the heart. So I'm going to go to cardiac. Now you can see that the probe marker in cardiac went to the other side in the usual cardiac fashion. But if you wanted to switch it, all you have to do is press on here. It'll switch to the other side. I'm going to go ahead and do that. And it switches to the other side if that's how you like your cardiac imaging. I like it with the probe marker on the right. It's in typical echo, so I'm going to do that. And cardiac's got some cool stuff, so I'll be able to show that to you. So firstly, before I do that, I just want to show you when you go to actions, and I forgot to point out before, you have this education here on the bottom. And so there are videos that are relevant to all the different presets that you did. So here, focus cardiac protocol, hemopericardium, subcostal, so different education you can get. So if you forget how to do the images or you want a reminder, you can get that right from your app, which is pretty cool. There's also the cardiac protocol here, as you can see right in the middle, and that similarly to the EFAS protocol can actually take you through the different images that you might want to get as part of your protocol, and it will label it just as the other one did. I'm just going to exit that protocol. All right. And then you have your Doppler modes, your M mode, your color Doppler, your pulse wave Doppler, and I'll show you that. Biplane actually is two images that are perpendicular at the same time. I'm actually going to show you that in the vascular, which we'll do in a little bit. But just to show you some of the cardiac stuff and how the Doppler functions pretty nicely. So I'm going to get rid of the actions. Here is an apical four-chamber view of my own heart. It's a little bit difficult as I'm speaking at the same time and getting the lung in the way. So you can see the color Doppler is pretty good. And the same as you would see really in any larger ultrasound machine. I could turn off color Doppler. And I'll show you some spectral Doppler in case you want to do some diastolic function. So it has pulse wave Doppler. And then you just move your finger. I just put my finger on that blue dot and position my wave where it should be. And then on the top left here, you see spectrum. You can get your image there. Then you could freeze and you can interpret your image or take any measurements in the preset. And then I put my hand on the blue dot and I can measure whatever it is that I need to measure. And then I could save it by pressing on that camera button. Now I can unfreeze it, get rid of pulse wave Doppler, and then I'm back to B mode imaging. So that's cardiac. It has a great parasternal, also just really good quality imaging, despite the fact that I'm doing it on myself. It actually looks pretty good, especially when I stop speaking. There we go. Let's head off to lungs. I'm going to show a lung preset and something cool that they have. So on the lung preset, it has an AI feature where you can count B lines. So I'm going to go ahead and put the probe on my lung here. And so here is my lung. I clearly have lung sliding. You can see the A lines really nicely. We don't see any B lines, but if you wanted to actually get that in a number, you can see here, there's a lung protocol. It's like with anyone else. There's the education, but there's also a B line counter over here. And so I'll show you how that works. If you press B line counter, it'll count for you. So it takes about 6 seconds and it'll tell you how many B lines there are. And so I have 0 B lines. Yay! You can save those numbers to your images and submit them as part of the report. So let's X out of that. The other thing I want to show you is something called the IQ fan. So IQ fan up here. And the reason the IQ fan exists is essentially fans through the lines of the lung in case you have trouble seeing the A lines. Sometimes you have to fan a little bit left and right to see them. So if I press IQ fan, it starts fanning for me. So you can see that it fans. I'm actually not moving the ultrasound probe at all, and it is simply fanning through, so I can have an easier time seeing the A lines if I can't see them normally. So that's pretty neat. There's the IQ fan. All right, and lastly, what I'm going to show you is as part of Vascular Access. And honestly, what I think is the coolest function of this ultrasound machine and what makes it really unique is the biplane imaging. The biplane imaging allows you to see in two perpendicular planes at once. So in the Vascular Access, I'm going to go ahead and find one of my veins. Let's find my basilic. I saw my brachial artery. Okay, here's my basilic vein right in the middle. You can see that it's compressible. Here I can go along it. So let's say I wanted to put an IV here on my basilic vein, but here I have it in short axis, and now normally to turn it long axis I have to turn my probe, which I'm doing now, so it can get a little tough to do, especially for novices, but even as folks more experienced, it can be a little bit difficult. So firstly, if you're putting in an IV, you can go to the actions. Hard to move as I'm using both my arms, but you can have a midline as a needle guidance. So I put the midline here, and you can see that there's a line down the middle if I wanted to help guide my needle. Oh, there it is again. So here I can put the probe in the midline so I know exactly where they are right there. And so the other thing you can do is the biplane imaging, and I'm going to show that to you in a sec. I go back to actions, and then biplane right over here. Now, you can look at the bottom, and this is the short axis plane, and I put that green line right in the middle. That's right midline. And then at the top, you can then see it in long axis. So I've used this clinically, and it is super cool because you can then watch your needle in short axis to make sure you're on the right trajectory to hit the vein, but then you can also watch it in long axis at the same time going into the vein so you don't backwall it. So this takes the long and the short together and allows you to see both on the screen at the same time, and you don't even have to turn your probe. And this is super cool, and honestly the coolest thing about this new Butterfly, and a feature that I think is great and is, from my understanding, is unique to the Butterfly IQ3. The other thing that I have that obviously I can't show you, but I'm just going to point it out. I'm going to get rid of the midline and the biplane by Xing them out. And there's also a needle visualization that allows you to see the needle. It'll highlight it in blue if you have it. And so if it changes the ultrasound screen a little bit, but if you have a needle, it'll then highlight it in blue and makes it easier to see. This can only be done in long axis, but that's a nice feature as well. I've used it, and I don't have any images of it, but it does really help highlight the needle when you need that, especially for smaller needles that don't have as good visualization or not as acoustically friendly on the ultrasound. So there you have the Butterfly IQ3 and the review from Peachtree POCUS. Overall, it's a really excellent probe. The image quality has gotten way better and is way more functional. I'd be very happy using it in an emergency department. Having the different cables that you can use, either the lightning cable or the USBC, is a major improvement. The biplane imaging, as I really stress, has been awesome. So I think this probe has really come a long way. I think the image quality is great, especially at the price point that you get it. I think anyone getting this probe is going to be really happy with what they get. I was very happy using it, and I would definitely recommend it to others who want a portable handheld ultrasound device. As always, if you need help choosing a new ultrasound system, if you need help with your operations to implement your workflow, billing, education, anything, reach out to me at Peachtree POCUS. I'll work with you and to help up your POCUS game for sure. And I will see you on the next video where I review another handheld ultrasound machine, which also has some cool, exciting features.